Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmilkoffer, and I am a doctor at the Neurologic Wellness Institute. And today's question is, when should you start therapy following a concussion? And this to me is a really important question, especially in fall here with football season and soccer going on, because there are many more sports-related concussions going on out there in today's world with high school and college sports. And so I wanted to bring forward this paper talking about when to start vestibular therapy and the return to learning and return to play and symptom resolution after a concussion. But before we talk about this paper, I did want to mention in the past I have talked about other papers, one being exercise is medicine for concussion. And the earlier to start exercise, whether that be a low, moderate, or higher intensity exercise, depending on symptoms, can improve overall recovery from a concussion. And so then I'm not sure I've talked about this, but there is another study that talks about just going to a doctor to seek evaluation has a faster overall recovery than not going to or delaying going to see a doctor. And so basically the best answer for me is the earlier you start vestibular therapy, the earlier you start therapy in general after a concussion, the better chances you have of returning to play, returning to learn faster. So let's get into the study and we'll kind of discuss some of the properties here. First of all, I want to emphasize with this study, it is a pilot study. So pilot study means that there are less participants. They're basically just doing this as a way to see if there are going to be any findings and would it be then useful to put more money into getting more participants for a bigger study. So pilot study evaluating the timing of vestibular therapy after sports-related concussion is earlier better. It is from Sports Health Journal, and I believe it is a more recent article in 2021 here. So this study specifically just talks about vestibular dysfunction is characterized by nausea, dizziness, imbalance, and gait disturbance, which represent important sports-related concussion subtype associated with prolonged recovery. So vestibular physical therapy can promote recovery, but we're not sure if earlier therapy is better or not. So it was a retrospective cohort study, so they just looked back at previous athletes and when they got therapy, when they didn't. So the patients were either aged between 5 and 23 years old, which is a very big separation, and that's the reason, again, it's just a pilot study, with sports-related concussion who initiated vestibular rehabilitation therapy within 1 year. So the therapy initiation was defined as either starting early, so less than 30 days after concussion, or late, over 30 days. Basically what they found, they had 23 total patients, 10 in the early group, 13 in the late. You'll see that they had about the same age range in the 10 in the early or in the 13 late. The late therapy group required additional time to return to play, 110 days versus just 31 days in the early initiation group, and also more time in achieving symptom resolution, 121 days versus 54, but not return to learn. Return to learn was basically equal. So basically what the conclusion is, they said that vestibular rehabilitation therapy within the first 30 days is associated with earlier return to play and symptom resolution. Again, more studies should be filled out this. But this is really important because it's not the only study that shows that exercise, which vestibular rehabilitation can be a form of exercise, can improve blood flow and oxygenation to the brain and therefore decrease symptoms faster. And then clinical relevance, basically clinicians should screen for vestibular dysfunction and consider modifying follow-up schedules in order to initiate vestibular rehabilitation therapy within the first month of injury to improve outcomes. So if we go to this table down here, I just want to talk about this one. And so with the patient outcome data, well, first of all, basically vestibular therapy, again, the early group was 21 days on average. It's either 17 to 28. The late group was 74 on average, anywhere from 37 days to 125 days. But days it took to get them to the concussion clinic were about equal, which is interesting, which means that even though they got to the concussion clinic at about the same rate, some did not start therapy right away. Whether they weren't recommended to start therapy right away, whether they were not wanting to start therapy right away, did they want to hold off, was it a money thing, a time thing, whatever it was. But the key is that they still went to the concussion clinic at around the same time after injury, but it was whether they started vestibular therapy or not, which made the big difference in improving outcomes. So again, for the early therapy, they only had an average of 2.5 treatments versus the late therapy had only 4. So it really didn't take that much therapy in order to improve outcomes, which is pretty cool. Now, maybe if there are more outcomes or more therapy sessions, or maybe they had a bunch of home exercises as well, but either way, more therapy sessions might have actually improved outcomes faster. Number of follow-ups, so they had maybe slightly less follow-ups than the late therapy, which might be necessarily, right? So days to symptom resolution, 54 versus 121 in the late. Days for return to play, 31 versus 110. Now again, why is the symptom resolution more than the return to play? Shouldn't the symptoms be gone before return to play? My opinion, yes, they should be. So I'm not sure what this is and why, but again, it is a retrospective study. So maybe that's something that was not in the guidelines when it came to athletic trainers, physical therapists, doctors that needed a complete symptom resolution before returning to play. However, their days for return to learn were about equal. If anything, there may have been close to significant where it was actually the earlier therapy took longer to get to return to learn than the late. And again, maybe this is why the late therapy decided not to start therapy right away, because they returned to learn relatively quick. They thought their return to symptom resolution would be just as quick. We're not sure. But we do know here that within just these 23 patients, returning, or basically in order to have symptom resolution and return to play faster, it is better to have earlier vestibular therapy. So again, what does this say? This says that when you get a concussion, when anybody in your family, friends get a concussion, the earlier time to start vestibular therapy, the better, because we are going to get more oxygen to the brain. We're going to heal or improve the function of the brain, especially in those areas that are really likely to have damage after concussion, which is the brainstem, the part of the brain that the big brain kind of sits on top of. And if we can improve oxygenation there, we can improve functioning of the brain, then that is going to decrease symptoms levels. Now, at the same time, people may have post-concussion syndrome later on. Well, maybe this, by starting therapy earlier, is going to prevent post-concussion symptoms, post-concussion syndrome in certain patients, because again, we're healing faster. So if you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. I hope this was valuable for a lot of people to hear and see. And if you have any future advice or you want to send this out, please share with other people. I hope you have a great day. Stay healthy.